the lecturer can also mark online as well.
Yeah, it will mark itself automatically.
So do you give the answers?
Yes, you give the answer to the machine.
You provide the answers to the machine, then it will mark.
Yes.
Hello, Doc.
Wow.
My network went off. What did I miss?
Oh, you missed a lot. We are going to be having MCQ soon.
And I was the moderator.
Yeah. So I was saying that yesterday one of my sons was on Google Classroom.
Okay.
And I noticed that he had multiple choice questions.
Yeah.
That he was answering.
Yes.
And so like you pick the correct answer out of the options. And I was actually amazed. I didn't know you could do stuff like that.
Oh yeah, as Olu was saying, very possible.
So I'm just thinking that if we can do that, then maybe instead of the assignments, we could just have a couple of multiple choice questions.
Yeah.
And that would be our mid-semester.
Yeah.
You know, okay. Maybe I think that will also help you to revise.
Yeah.
So if maybe every week we have one, maybe on Saturday morning, 10 questions. And then
Madam,
very possible.
I'll tell you the areas that it will come from.
That's
so
fine.
Maybe if we do 3 or 4 slides, then we have some 10 MCQs on it. Then another 3 or 4, so that by the time we'll see. I think it's a good idea. So
Jenny man can't go. Jenny man can't go.
The exam on
even I think that even with
I saw my son doing his work and I was so amazed. Okay, so I think we can start.
Yes, look, we can start.
Yeah. And when the latecomers come, they will catch up. Otherwise,
sure.
Okay.
Hey, keep quiet. Oh,
today we are going to discuss mechanisms of immune-mediated diseases, and this is a continuation from yesterday.
Okay.
But yesterday was looking at the physiology, or what happens normally in the body. Today we are going to look at the pathology, or what happens when there's a disease condition. So it's just going to involve 3 basic conditions. I don't want to overwhelm you with too much, but these are the basics that you need to understand at your level so that you can manage the patient appropriately. So we are going to talk about hypersensitivity reactions, autoimmune disease, and immunodeficiency states. So hypersensitivity reaction means that antigen-antibody reactions that lead to tissue damage. Then autoimmune disease is a disease where the body fights against its own antigens. So autoimmune. Auto means self. Then immunodeficiency diseases are disease states in which the immune system is down. So yesterday we looked at the components of the immune system. We saw how the immune system is able to overcome diseases. And so if you have a situation where the immune system is down, for example, in HIV or in diabetes, then the body is now open. So the disease is not the pathology. The pathology is the fact that when the immune system is down, the body is now unable to defend itself from the onslaught of pathogens. And that is what will cause the disease. Okay, so let's start. So hypersensitivity reactions are a form of immune-mediated injury. Now, in hypersensitivity reactions, the body's immune system is intact, and it results from a normal immune response to an antigen. They are classified into 4 groups. we have type 1, which is the anaphylactic or the allergy type of hypersensitivity reaction. And this results from antigen and the antigen and antibody reaction. In this instance, the antibody is IgE and the antigen is called an allergen. And so the allergen is the one that is triggering the type 1 hypersensitivity reaction. So when the IgE antibodies are absorbed onto mast cells or basophils, then these absorbed IgE molecules will now bind to the specific allergen. And when it binds to the allergen will trigger the production of vasoactive amines and cytokines. And it is the cytokines that will cause the increased vascular permeability, smooth muscle contraction, and then damage to various tissues and organs. So to summarize it, the allergen will cross-react with the IgE antibody and lead to the release of vasoactive amines and other mediators, which are cytokines. Then this leads to the recruitment of inflammatory cells and then subsequently tissue injury. So examples of these are anaphylactic reactions and bronchial asthma. So you've heard of people who have been bitten of, is it bitten? Bees, what do? They sting. So people who have been people who have been stung by bees and have died. So you have a massive bee sting and it can cause death. Or patients who have bronchial asthma. What happens? In bronchial asthma, there are things that the patient is allergic to or sensitive to. So the patient will inhale this, maybe dust, maybe strong scent or perfume. Now, when the patient inhales it, the IgE absorbed onto the mast cells and the basophils would trigger the immune reaction by cross-linking with a particular allergen, which is the dust or the strong perfume or whatever. And this will lead to the release of histamine. And the histamine plus other cytokines will cause bronchial muscle constriction, excessive mucus production, and then autoimmune diseases, but the mechanism of antigen antibody formation is present. So that's why it's also here. Okay. Then type 3. For the type 3 reaction, is also known as immune complex disease. Now, in this case, you have the antigen antibody forming, but it forms a very large antigen antibody complex. So you have massive amounts of antigens, massive amounts of antibodies. The two of them will form a complex. Now, this complex will precipitate in various vascular beds. Examples occur in glomerulonephritis, where they go and accumulate in the glomerulus and cause disease like nephritic syndrome. The immune complex leads to the activation of complement and then attraction of neutrophils, which causes tissue damage. And so in immune complex reaction, the type 3, you have large antigen antibody complexes forming. So examples are certain forms of glomerulonephritis, a condition called systemic lupus erythematosus, where there's massive tissue damage throughout the body. It affects the eyes, the skin, the kidneys, the heart, so many areas of the body. Then we have serum sickness and Athos reaction. You can just quickly read on these just to help you to have an understanding. You're not getting a detailed description of what the disease is and how to treat it and all that, just for you to understand how and the type 3 hypersensitivity reaction comes into play here. The last type of hypersensitivity reaction is a type 4 hypersensitivity reaction. This is also called delayed type hypersensitivity reaction. In this type of hypersensitivity reaction, it is the T cells which are at the forefront of this reaction. So what happens is that you have an antigen introduced into the body. It can be bacteria, for example. Now, this bacteria would lead to the sensitization of T lymphocytes. And the T lymphocytes would release cytokines. And these cytokines would lead to T-cell mediated cytotoxicity and tissue damage. So example is tuberculosis. Another example is contact dermatitis and transplant reaction. Another example is BCG reaction. So the mothers amongst us, we know that when our babies go for BCG or when they went for BCG injection, after a while, you see that the place becomes like a boil. It gets swollen and then becomes a sore. And when the sore heals, that's when you see the scar. And this is a type 4 hypersensitivity reaction. It's a tissue damage at the site in reaction to the introduction of the killed killed mycobacterium. That is what leads to that excessive hypersensitivity and gives rise to that tissue damage. Okay. In this case, this is a vaccine. It's a vaccine response and it's protective. So this sensitized T lymphocytes will stay in the body and sort of develop memory so that if you get infected with TB, you will not have severe disease. Okay. Now the TB reaction, the TB infection itself is also a delayed hypersensitivity reaction, and so you'd realize that they have a lot of tissue damage in the lungs. If you take an X-ray of a patient who has TB, you realize that there are a lot of tissue destruction called cavitations in the lungs. So that's as a result of type 4 hypersensitivity reaction. Okay, so that brings the curtain down on autoimmune disease. So the next thing we are going to look at is, on hypersensitivity. So the next thing we are going to look at is autoimmune disease. So autoimmune disease means that there's a breakdown of one or more of the mechanisms that help to protect our self-antigens from each other. Now, the process or the phenomenon whereby the body recognizes its antigens as itself is called tolerance. So tolerance means that the body sees an antigen, but it can tolerate it. It will not attack it. The immune system will not fight against it. So if you have an autoimmune disease, it means that tolerance has been broken down. And the breakdown of the tolerance and the initiation of the autoimmune disease has both immunologic, genetic, and microbial factors. So immunologic means that there's a problem with the immune system. Genetic means it's genetically mediated. And then microbial means that there are pathogens that can also trigger this. Okay. So let's look at the various mechanisms of autoimmune disease. The first one is failure of tolerance. So usually in the T cells, when the T cells are being produced, any T cell which is autoreactive or does not recognize self for any reason, maybe there is some defect in its production, so it is not able to recognize the self antigens. Those particular T cells are identified and undergo death by apoptosis. So if you have a situation whereby there is persistence of these autoreactive T cells, then you have failure of tolerance and you can have an autoimmune disease. Now, there's also breakdown of T cell energy. So usually, the T cells have co-stimulatory molecules on them, which recognize other molecules on other cells, and they recognize them as self. So if you have a situation whereby those co-stimulatory molecules are lost, then you can have a breakdown of this T cell energy, and you can have an autoimmune disease. Then we know that usually the T cells, when the T cells are stimulated, they stimulate the B cells to produce antibodies. If you have a situation whereby for some reason this doesn't occur, that is, there's a bypass of the B cell requirement for the T cell help. That is, you have a situation where the B cell becomes autonomous and works by itself without getting input from the T cell, then you can have an autoimmune disease occurring. Okay, so this is an example. The diagram is showing a drug-induced modification in the protein. So the self-reactive B cell here, you see that the B cell has several molecules on its surface. Now, for the B cell to be able to cause the reaction, it needs the T cells to trigger the receptors on it for it to cause an antigen antibody reaction. Now, if you have a situation whereby the B cell goes ahead to undergo the reaction, you have this B cell reacting with self-antigens and leading to an antigen antibody reaction. Okay. Now, there's another mechanism, failure of T cell mediated suppression. So usually when there's a T cell reaction for T cell stimulation, there can also be T cell suppression. Interleukin 10 is one of the lymphocytes is one of the cytokines which are involved in T cell suppression. So if you have a situation whereby you don't produce the T cells which causes suppression, then you have a situation whereby this autoimmune disease will occur. Then the last mechanism of autoimmune disease is called molecular mimicry. So to explain molecular mimicry, you have a bacteria or a virus which enters the body. The bacteria or the virus has similar characteristics to something in the body. Some streptococcal streptococcus, they have a protein in their cell wall called M protein. Now, this M protein has similar characteristics to a protein in the heart muscle, also M protein. So if you have an infection with streptococcus, if that infection triggers antibody production, then these antibodies can also cross-react with the M proteins in the heart and lead to a disease called rheumatic heart disease. This is something that typically occurs in children, and it follows a streptococcal throat infection. It isn't all streptococcus that triggers this. It is certain or specific types of streptococcus that would lead to this. And we call these rheumatogenic streptococci. And that is why in pediatrics, it's very, very important that when you have a throat infection, it is well treated so that you do not have these antibodies released in the system that can cross-react with the heart and lead to rheumatic heart disease. Okay. Then the last mechanism is release of sequestered antigens. So we have some antigens in the body which are not exposed to the general circulation. For example, certain antigens in the eye or in the testes. These parts of the body are not in general circulation. They are not exposed to the general circulation, and so they do not trigger an antibody response. If you have a situation whereby these antigens become exposed to the circulation, then you have an antigen antibody reaction. But in this case, because those antigens are not recognized by the immune system of the body, you will have an autoimmune reaction. So an example is if you have trauma to the eye, you can have a reaction called post-traumatic uveitis, whereby because of trauma to the eye, you release the antigens of the eye into the blood circulation. Because with trauma, it means that you've severed the blood vessels and there's that exposure of the ocular antigens into the general blood circulation. So the white blood cells will vigorously attack these ocular antigens and end up with post-traumatic uveitis. The same thing can occur with orchitis. As a vasectomy, if there's exposure of, once you truncate the spermatic cord and there's some bleeding and all that, you expose these spermatozoa to the blood vessels and you can have a reaction where there's inflammation of the testes. And so to combat these, usually they are given steroids to prevent the inflammatory reaction that will occur. Now, there are some genetic factors in autoimmunity. A disease like autoimmune hemolytic anemia, whereby there's destruction of the red blood cells leading to breakdown and anemia, or SLE, it has been found that there's a strong genetic association. Good morning.
Hey, Doc, your tree.
My tree has done what? It's not good, eh?
Oh, you tried.
And I can.
Anyway, Doc, let's continue.
I'm not a can, you know, Okay, good. So people are just this early Saturday morning. Yesterday he was calling me in the night. I ignored him. I saw his message, but I just decided I wouldn't be bothered. Some people just like to behave like you're their personal doctor. You have to try and avoid that.
Punchline. Madam, this morning your cheek come off.
So yes, there are some genetic factors associated with autoimmunity, and we know some specific HLA locuses on the genes. So HLA-B27 is associated with ankylosing spondylitis, which is an autoimmune disease affecting the spine. And infection is also associated with autoimmunity. I talked about streptococcal infection and cross-reacting with the M proteins of the heart. Then you can also have certain viruses, and then Klebsiella 2 is another one of them. The viruses are typically Epstein-Barr virus. So Epstein-Barr virus is associated with a lot of autoimmune reactions. Okay, so the last thing, we are about finishing, don't worry. We look at immunodeficiency. Now, for immunodeficiency, basically what it means is that the immune system has been crippled, and so now the body is open to several diseases. So immunodeficiencies, there are two types. We have primary immunodeficiency diseases and secondary immunodeficiency. When we say primary, it means that you were born with the problem with your immune system. And usually, typically, you see it in babies or infants. Let me say infants. So you can have immunodeficiency diseases which occur. You see that this baby is always ill, this baby is not growing well, this baby is not doing too well. And it might just be because they have a primary immunodeficiency. The secondary immunodeficiency disease occurs when there's a condition which is causing your immune system to be suppressed. So a typical example is malnutrition. When you're malnourished, you don't have enough proteins, you don't have enough calories. And so we need proteins to manufacture immunoglobulin. So just because of the absence of proteins in your immune system, you are immunodeficient. The aged, they also have immunodeficiency. Patients who are taking immunosuppressant medication, for example, patients on steroids, we know that steroids would suppress the immune system. Or patients on cancer treatment, chemotherapy, can also suppress the immune system. Patients on radiotherapy can also be termed as immunodeficient patients. And so these ones are secondary. Your immune system is fine, but because of something, it is down. So that's a secondary. If you have a situation whereby your immune system from birth is down, then that's the primary immunodeficiency. So basically, that is what it is. Now, another thing to take note of is that infections that you will be affected with. We know that the immune system is made up of immunoglobulins, complements, T cells, B cells. Basically, antibody production will be problematic. So you will be prone to a lot of bacterial infections. If you have a problem with your T cells, you know that the T cells will kill viruses and cancer-infected cells. And so that will open you up for cancer and viral infections, fungal infections, intracellular bacteria. Okay. So let's zone in on the primary immunodeficiency states. Now, collectively as a group, primary immunodeficiency states are rare. Okay. And the other thing about them is that they are genetically determined. So they can be autosomal recessive, X-linked, dominant, and so on. They are genetically determined. And they affect specific components of the immune system. So either the humoral immune system or the cellular immune system. And they are usually classified based on the type of immunodeficiency that occurs. The other thing, the last point about them is that they occur early in life. So usually between 6 months and 2 years of life. And somebody will ask, why doesn't it occur before 6 months? The thing is that usually when the mother breastfeeds, so this is another reason why we encourage women to breastfeed and to do so exclusively. When you are breastfeeding your baby, you are giving breast milk. The breast milk contains all the antibodies to all the infections that have ever worried you in your entire life. So it's like the baby is getting ready-made immunity. So the baby is fine. Once you decrease the amount of breast milk from 2 years going, you stop breastfeeding, you start giving other feeds. Now you're introducing other things which are a potential source of pathogens. And now the baby is not getting as much breast milk as before. So the antibody level would reduce. And then the baby's actual condition will now be exposed because now the baby doesn't have any already made antibodies or they have decreased levels. Meanwhile, you're also introducing other foods which are a potential source of pathogens. So usually between 6 months and 2 years of life, if a child is constantly coming to hospital, always sick, always one issue after the other, then you would have to think of a primary immunodeficiency state. Okay, so there are plenty. We have the primary immunodeficiency states, about 8 of them, and then we have secondary immunodeficiency. So the primary immunodeficiency states, we have proteins A gamma globulinemia, common variable immunodeficiency, isolated IgA deficiency, hyper IgM deficiency, thymic hypoplasia, which is also called DiGeorge's syndrome, then severe combined immunodeficiency with Scott-Aldrich syndrome. I personally saw a case in 37. Then there are also deficiencies of complement components. So we'll take them one by one. We'll try not to say too much about them, okay? But it will look plenty. But what I want you to take note of is one, the kind of inheritance. So is it X-linked? Is it autosomal recessive? What is it? Secondly, what does it do? Or what is the problem? Then thirdly, how does it manifest? Or just that. Okay, so how is it inherited? And what problem does it cause? How does it manifest? Once you can recognize it, you are good to go. You can tell the parents something so that they understand what's wrong with their child. Okay. So Bruton's disease is one of the more common forms of primary immunodeficiency. The problem is that there's a failure of the pre-B cells to differentiate into B cells. So the B cells are, they have precursors. So the precursors are the pre-B cells. So the pre-B cells are supposed to differentiate and become B cells. And so this is the problem. It is an X-linked disorder. So that tells us that it is seen primarily in males. However, if you have inactivation of the X chromosome, one X chromosome in the female, you can also have it occurring in the female. So what will happen? There will be a decreased amount or an absence of B cells in the general circulation. And this will translate to decreased amounts of all classes of immunoglobulins. Take note that the B cells help with the production of immunoglobulins. So first of all, if you check the serum, and this translates into decreased levels of immunoglobulin. So clinically, if you suspect this, you just take a sample and send it for immunoglobulin assay, and it will come back and tell you that all the immunoglobulin classes are down. IgE is down, IgM is down, IgG is down, IgD is down. Okay. IgA is down. Okay. So in this case, it's the B cells, but the T cell mediated responses are normal. So it doesn't become apparent until the child is around 6 months of age, because by this time the maternal immunoglobulins are depleted. The ones that the child got from the placenta, and then the ones that they are getting from breast milk, the levels will start decreasing. And most of the time, because it's B cells, the children will be prone to recurrent bacterial infections. So chronic pharyngitis, throat infection, sinusitis, otitis media, that's infection of the ear, pneumonia, bronchitis. Okay. And the typical organisms that are seen are the ones that need antibody for opsonization. I didn't really talk about opsonization yesterday, but opsonization is a process whereby the antibody coats the antigen and presents it for destruction by the phagocytes. So typically, most of the organisms that infect these children are H. influenzae, Streptococcus pneumonia, Staphylococcus aureus. Take note that in our current EPI, that's expanded program on immunization, we vaccinate against H. influenzae, and we also vaccinate against Streptococcus pneumonia. So the only thing left is the Staphylococcus aureus. So if you have a child who keeps getting boils, recurrent boils, this might be something to think about. If it's a boy, is it a primary immunodeficiency? Okay, we have less than a minute.
Yeah.
If there are any questions, ask your questions before we go. But okay, let me go on since there are no questions. Okay. So how do you manage these patients? You can give them replacement therapy with intravenous immunoglobulin. So you give them an IV infusion of intravenous immunoglobulin. But if you look closely, they are able to